There's concern that with the oil spill and the oil being washed on shore, the oil contains two components. It contains diesel fuel and crude oil. The constituents of these contain something called volatile organic compounds, which vaporize in the air and can cause an odor. And there is concern that if you're swimming in the water or on the beach, you will then be able to smell this odor. These hydrocarbons can cause irritation of the eye, the nose, the back of the throat. They can cause a flu-like illness if the odor is very strong, like headache, dizziness, nausea, and vomiting. They also have issued the swimming advisories because there are clumps of oil that can get onto your skin. If they're washed off very quickly, they shouldn't cause a problem, but they can cause some skin irritation, and if left on the skin for a prolonged period of time, may even cause a mild burn. So the reason the swimming advisories have been issued is especially for vulnerable cohorts of people like young infants, small children, people with asthma, respiratory conditions, or the elderly who may be more susceptible to respiratory irritants, which may further exacerbate their disease. Or we know there's just individual susceptibility to smells and odors, which may cause irritation. In addition, young infants and young children's skin is much thinner than school-age children and adults. So the oil and some of the volatile compounds may actually permeate into the skin. Young infants and young children may be more susceptible to the adverse health effects from this oil spill, particularly the vapors and the particulate matter, because their breathing pattern is different than adults. They breathe at a faster rate. So if you breathe at a faster rate, you're more susceptible to having more of these compounds enter into your body. In addition, there's a theoretical concern about consumption of food, because young infants and children consume more food on a pound-by-pound basis than adults, theoretically then increasing the exposure to any chemicals in the food. If your child experiences any of the following symptoms, such as watery eyes, red eyes, watery nose, scratchy throat, and most importantly, difficulty breathing, definitely you need to get out of the area that you're in right now, get into an enclosed area where there's air conditioning with recirculation. If the symptoms persist, you should seek medical attention and call your primary care doctor.